Kia ora tato. Ko Jane Torrie tōku ingoa. He takato moe aho. Thanks for the opportunity to share some information about the NetworkZ New Zealand project, a project that fits very well with the objectives of the Safe Airways Society. NetworkZ is now in its 5th year and near the end of its initial funding. It doesn't yet have secure ongoing financial support. So here are some of the important features of the NetworkZ program. I'll describe these in a little more in the presentation as I go on, and I'll give you the public website address at the end for a lot more information. You'll see that the simulation-based program has an explicit focus on teamwork, that it engages whole experienced teams with cases that are interesting, and it's hoped that the improvement in teamwork skills and team climate that we're seeking will improve both emergency and routine care for patients in the future. Because implementation has been in situ all over New Zealand, this has become quite a powerful method of testing systems in the operating room. I'm going to talk mainly about the NetworkZ operating room context, but I will mention the expansion of NetworkZ into some other areas more recently. All these photos that I show were taken during NetworkZ activities, and the subjects gave permission for them to be shown to illustrate the program. So here's some of the early instigators back when we had just got funding for the national rollout after an initial pilot. I'm there, I'm one of a multidisciplinary team. My role has been mostly around session and scenario design, facilitation and training the trainer. So that was a multidisciplinary group representing the main craft groups in the operating room. And as a reminder, operating rooms are action groups, action teams, by which I mean they assemble to do a specific task, highly specialised skills, high degree of coordination. The team composition and skill mix can vary from day to day or even from hour to hour, even in quite small institutions. So coaching these craft groups to create a shared mental model for better patient outcomes has always been the key objective really for NetworkZ New Zealand. The NetworkZ project started in the operating room with training for these surgical specialties. So I'll start with that perspective, and then I will mention some NetworkZ cases where the airway was the main focus of the event. You have to get the whole team together to practice team skills, and we seem to have done that fairly well with NetworkZ. You'll see the proportions represented here of the different craft groups is representative of the proportions in New Zealand operating rooms. The numbers on the right here, for New Zealand, these are quite large numbers. I've extrapolated it up for the Australian population size. About 60% of New Zealand operating room staff have had some exposure to the NetworkZ OR program. Instructors make up, or instructors in training make up quite a large number as well, because the goal of NetworkZ was always to build capacity by training local people to deliver local training. And when you get a large team, you're looking at a large opportunity cost. Especially in the operating environment, which is an engine room for many institutions for income generation. Team time like this is really precious and should only be used for teaching skills that can only be practiced or taught when the team are together, although sessions can and do shed light on individual knowledge gaps or decayed task skills. So NetworkZ had to come up with an engaging product for teams and their managers to get this resource-intensive program across the line. We needed buy-in. And some of our initial research looked at what aided buy-in, and here are some of the aspects of it. Painstaking scenario design with leads from each craft group. Make sure there was something for everyone in the design of the cases. Including representation for some of the important supporting services or supporting people for running an operating room. The highly realistic simulations or real processes that are used helped with buy-in. So every institution, even those with sim centres, decided to run this program in their operating room. The scrub nurses use their own instruments, the anaesthetic teams use their own difficult airway trolleys, the backstories, the patient notes, the investigations. All these things are tailored to the location. Whether you're a small remote hospital is really can be quite different from if you're in a large tertiary referral institution. Attention to detail, here are our simulated blood products. I want to point out the assistant in the room. Some people call this a confederate. This person takes part in the simulations in their normal professional role, but they are there to add to the flow and realism. They convey clinical signs to the participants that the mannequin can't convey. They help the participants complete tasks if they have to be modified a little bit because of the simulation, such as extra air and an endotracheal cuff, for example, to achieve a seal. They inform the instructors at the console when clinical actions are being performed or about to be performed, such as clamps put on or drugs given. They're extremely valuable. Another aspect of buy-in, each institution got some nice gear. They got a whole body simulator, and NetworkZ commissioned these surgical models which integrate with them. And there's enough recreated features in those models for all participants to be engaged. Buy-in. A structure to debriefing that is clear, even new debriefers can use well, that explores teamwork and other human factors, and importantly facilitates a team to come up with solutions. You'll see this loop here of analysis, an issue, and an outcome. Come back to that later. Something that has been appreciated by managers and those in quality programs is that each session generates a report which explicitly looks at latent safety threats or good practice points and how to follow those up and resolve them, or how to reinforce the good practice points that are seen. Buy-in, building capacity. So apart from a mannequin and integrated surgical models, the institution also received a comprehensive train the trainer package with face-to-face and online training, and support from the central NetworkZ team until the local faculty are independent and secure. You'll also see on the right the craft group professional bodies all have recognised NetworkZ activities for CPD purposes. And finally, to make buy-in attractive, a comprehensive evaluation and research program associated with NetworkZ, which really is in three parts: how we going with delivering a quality project process, how our process measures being improved, particularly looking at teamwork and communication, and some harder outcomes. The primary outcome for the improved patient safety aspect is days alive and out of hospital after surgical procedures in hospitals in New Zealand, for which we have a reasonable access to a good database to look at that. So the project did get buy-in. We got a 5-year contract from ACC, the Accident Compensation Corporation, which is a no-fault compensation organisation which compensates an increasing number of treatment injuries, and saw this as a valuable prevention project. We had to get the DHBs to buy in, the district health boards that run all the public hospitals in New Zealand. And so the NetworkZ team made early approaches at senior level to these DHBs, did not offer the program unless the CEO had signed a letter of support and committed to have a project and delivery team. It's important to say there was no penalty for the DHBs if they did not engage with networks. The funding has never covered aspects such as backfilling of staff and plenty of other aspects of running this program, and these DHBs have made a considerable commitment. And they did all engage. The rollout in 4 cohorts in the last few years is part of the research design, the stepped wedge cluster. 2020 and 21 have been a little disrupted, shall we say, but the appetite is certainly there to continue the program. So what will you see when you take part in a network session? You'll see in a half day there's 2 challenging cases with debriefs, and there is communication skills training, discussion sessions, using animations and trigger videos created for those sessions. The scenario delivery and the communication skills training are tailored to the operating room team, and the DHB context. You'd also see this poster up on the wall, a Salas model of teamwork. And this key concept here really is up on the left, the shared mental model, as I mentioned before. It's not only about the plan and goal for treatment and a shared understanding of the environment, but also the roles and capabilities of the other members of the team. So the team can anticipate and predict others' needs as they carry out the care, and you can identify changes in the situation or tasks and adjust, so you become an adaptable team. To get a shared mental model, teams have to have mutual trust and respect, so that all the members feel safe, they understand how the diverse skill sets contribute to solving problems, they feel safe to speak up with concerns or suggestions, and being spoken up to is accepted as a defence against error. In a network session, your existing strategies for sharing information, creating a shared mental model, and for problem solving would be discussed, evaluated, reinforced, practiced under some pressure. These are some of the hard stop points that exist in an operating room in New Zealand already, and were embedding further as our program rolled out, and we certainly aim to support them. You'd also find that other communication methods that help the team create a shared mental model would be explored and reinforced. So critically, the participants are facilitated to explore how they will use these sorts of tools and skills in their work as they do it, not as we might imagine they do it. The last photo was taken in an emergency department in a resus bay, and more recently NetworkZ has won a contract to deliver 2 half-day trauma simulations in emergency departments in New Zealand, complementing often an existing sim program in those institutions. You can see the mixed participants so far. These are real teams working in their own environments, as was the operating room program. Work is underway to expand networks into the obstetric and gynae operating rooms, into the recovery room, into radiology. There's demand. So there are a couple of slides about Airways in particular. Of the 25 to 30 scenarios in the NetworkZ library, all but one, who's already tubed, require airway assessment, decision making on who's going to do what, where, when, and how they're going to do it, and then it needs to be coordinated to manage that airway. So most cases have at least one feature, often several built in, that make airway management potentially more challenging for the team, and some of these are listed here on the right. Some of the scenarios do have airway management as the main event, the main focus. And for example, we have cases where there's a threatened airway due to expanding neck hematoma after a procedure, bleeding in the airway, foreign body, laryngeal tumour. The network's training objectives remain exactly the same in these airway focus cases. And so finally, I have listed 3 possible takeaways and also the address of the public website where you can find a lot more information about networks. So high-level buy-in and support at an early stage, engaging the interprofessional team for all aspects of the program, and then running it in situ with engagement with the quality improvement arm of that organisation have been key features for our success and engagement thus far. So thank you very much for listening. The program has not yet secured ongoing funding, as I said. We're hoping for the best.